what we do here at the Rutgers NJMS Medical School is we really focus on prevention. The more we prevent mental illness from manifesting itself, the better everybody is.
But treatment is equally important, especially because, there are a lot of people who focus on, even when they have severe depression, that I can now meditate or exercise and do it, just if I was strong enough, I could treat it myself. So while prevention is essential, once you are anxious or depressed or have a disorder, it is really vital to get treatment, right? And medications are very effective for anxiety and depression disorders.
And quite safe these days. But there are other things that people can do outside of medications. Exercise has moved to be a major way of self-help. And I'm not just going to the gym, but even taking a walk. If you take a walk, even better to do it in nature. Urban centers have parks, so if you take a walk, make sure that you walk somewhere there are trees and plants so that you help your mental health that way as well.
In fact, just sitting in a park or being in a forest kind of an area can be preventive in itself. And then there are other things like focusing on the positives in life, like practicing gratitude. If you have to do just one thing or take away one thing from this talk, it's gratitude. Just thinking about what all things you're grateful for. If nothing else, just life and air and family, that has shown to have a very positive impact on the brain. And then just practicing optimism and any kind of breathing exercise you can do, just focusing on your breath, can have a long-lasting impact.
Yeah. Focusing on your sleep as well. Sleep is a major part of wellness. 6 hours, that's the absolute minimum that we need as human beings to do well.
So it is not clear if it's the rates of anxiety and depression that have increased or it's the attention and recognition that has increased. Definitely during early years of COVID, the rates had started going up, and I think it brought the much needed attention to our mental health. But some of the other factors that are very prevalent in today's society is the isolation many of us experience. Social media can have some positives, but there's a lot of access to negative news. So sometimes, it always feels like the world is all going to bad. And it's not just because of that, it's just because there's a lot more attention to negative things, and they're all in our face in some ways because of the social media.
We have opened up here at the Rutgers NJMS Medical School, we have opened up to the community primarily through our Center of Excellence in Addictions. We have great partnerships now with community organizations to promote healthy living as well as treatments for opioid use disorder and other addictions. One of the things I'm most proud of is our partnership with faith communities, which is an incredibly powerful way of engaging our patients. Our very own Urban Mental Health Conference that we have every November is going to be focusing on the partnership between psychiatry and faith communities to better serve our patients.
It is important to remember that depression is a serious illness and can have serious symptoms like having thoughts of killing yourself or suicide, and feeling hopeless or feeling completely alone. And when that happens, one should seek help, and help could be a psychiatrist, but if you're in a crisis, you can also reach for crisis resources.
Yeah, and we do have a hotline. It's 988. It's very simple. Just you dial 988 and there will be a professional, somebody who's trained, who's going to respond and going to take you through the next steps. So there is hope, there is treatment, there are a lot of things that we can offer. Make sure that you talk to someone and take the first step, and things will get better.